For this lab, we'll be working on the neck region of the pony specimen, and you'll be dissecting both sides of the specimen, both left and right. So we'll actually start with a closer in view of the nuchal fatty crest, which will be in this region here, and then we'll reflect that to look at the nuchal ligament. So now we're looking at the caudal aspect of the neck of the pony here along the back. So you're going to look at this for the nuchal fatty crest. So you've already identified it, but you need to actually reflect the nuchal fatty crest. So that's just this part of the mane. So just deep to the mane is the nuchal fatty crest, the fatty part. And so you want to carefully reflect that all the way back. So you're going to take that back like that. And if you want to, you can actually just cut it off. And there's an optional part of the dissection where you can section this to see which part is the thickest. Because it's a regional differences. So the nuchal fatty crest is here, so I've reflected that, and now you can see the nuchal ligament right here. The nuchal ligament has two parts. So the part right on the top here is going to be the funicular part. And then you want to try and find the midline, so in between the two sides of that funicular part, so you have a left and a right side, and there'll be kind of a seam in the middle, and you want to try and find that, and then work in between those two sides. And then you'll have to look down inside, and you can see the laminar part. So that's this part that extends down inside the neck toward the midline there. So laminar down inside, funicular running across the top here. So both of those are parts of the nuchal ligament. So now we'll take a look at the atlanto-occipital space. And so that's up towards the back of the head. It's actually where your wire loop is suspending your pony. It's going to be right in that area, so it may be difficult to see. But the atlanto-occipital space is actually just the space. So I'm just going to put the probe in it. So that's the space, the hole right there is the atlanto-occipital space. So that's between the atlas and the skull, right there. Then you have the atlanto-occipital membrane, which may be difficult to see, but you can see part of it here being elevated by the probe. It's just that tissue, that fascia, that's very thick and covers that space. So that's the atlanto-occipital membrane. So that's what the wire passed through to get around the atlas. Now we'll go back to the lateral side on the left and take a look at some of the muscles for this region. So here we are looking at the left side of the pony where you've detached that left limb. On this side, you'll be looking at stumps of the muscles rather than the whole muscles intact for some of these. But you want to find the stump of the trapezius muscle, so that was cut to remove the limb. So you have cervical trapezius here. And then you have rhomboideus underneath that, so cervical rhomboideus muscle right there. And then you want to find the splenius muscle. So the splenius is in between your cervical rhomboideus and your serratus ventralis cervicis, which is right here. And the splenius is this kind of triangle in between there. So splenius, you want to uncover that. Then you also have the stump of your brachiocephalicus muscle here, where you detach that limb and cut it. So you want to just find the stump, and this is just the clidocephalicus part, and this is clidomastoideus in the pony. So this is clidomastoideus here, and then the omotransversarius in the pony, remember, is fused to your brachiocephalicus, so it would just be this caudodorsal edge here would be omotransversarius, but you don't need to differentiate that separately because it's fused to that muscle. Then under that, you actually have the omohyoideus, which is significant in the pony. Right here is the omohyoideus muscle. And it's in between the external jugular, which you can see here, and the carotid. So you can see the carotid is the pink here. And it's interposed in between those two. So that's the omohyoideus muscle. Then you have the sternocephalicus muscle. And in the pony, you just have one part, and it's the sternomandibularis portion of it right here. So sternomandibularis and sternocephalicus mean the same thing in the pony, and they're interchangeable terms. If you didn't reflect it, you may have cutaneous colli kind of covering over these muscles, so you'll need to reflect that distally to see those. So sternomandibularis has a long tendon, so when you move up towards the head, you'll trace the external jugular vein here and find where it has the branches of the linguofacial vein and the maxillary vein right here. So make sure you skin your head far enough, or your neck far enough forward towards the head that you can see this. And you have this little section of the parotid salivary gland also, and that will be slightly in your way, so you'll have to reflect that as well to see this area that I'm going to show you next. So parotid salivary gland, maxillary vein, linguofacial vein, and then external jugular vein. So you need to just reflect part of that parotid. And underneath you can see this sternomandibularis muscle has this tendon right here. It's nice and white. This tendon goes up towards the head and forms the dorsal border of what's called Viborg's triangle. So that's a structure that we've talked about, and it has the dorsal border is this tendon, and the other borders are the ventral border is the linguofacial vein, and then the angle of the mandible is going to be the other border there. So that's Viborg's triangle right in that area where you would drain strangles abscesses. So that's why that's significant. Then also here you can see the trachea. So once you dissect out your sternomandibularis and kind of pull that over to the side, you can see the trachea here. And then you need to dissect your esophagus as well. So the esophagus is right next to the trachea, right here. And on that ventral midline, you'll be dissecting the sternohyoideus and sternothyroideus muscles. So they come from a combined origin on the sternum, so you can leave them combined up until they start to split apart when they get closer to the head. So sternohyoideus and sternothyroideus are together here, and you have both left and right sides. Here they split apart into the left side and the right side. And here you can see the further splitting where sternohyoideus continues up further into the head, and sternothyroideus is going to split off slightly laterally and will go towards the thyroid cartilage of the larynx. So sternothyroideus going laterally, sternohyoideus continuing up towards the head. Then you also need to look at your carotid sheath. So my carotid sheath is mostly gone because I've dissected it away, but it's that deep fascia that surrounds the carotid artery and the vagosympathetic nerve trunk. So right here you have the common carotid, left common carotid artery, and then right next to it you have the left vagosympathetic nerve trunk. And those would be in that deep fascia called the carotid sheath. Also along the trachea, sometimes you can find them, sometimes you can't, but they're called deep cervical lymph nodes. So right here you can see some little lymph nodes. So those would be cranial deep cervical lymph nodes, and those are actually pretty nice. They're usually very small, and I don't find a lot of them. So those are nice ones there. And I found a couple little guys right along the trachea. So there's one little tiny one here, and there were some more down here, very small. Those would be middle deep cervical lymph nodes. You also have caudal deep cervical lymph nodes that would be farther back. But we don't really have those visible here. So if you can find some, that's great. If you can't, don't worry about it. And then the superficial cervical lymph nodes we'll look at on the other side because they were taken off with the limb on this side. So now we'll take a look at the right side of the pony. One thing I want to add on the left side of the pony that we can see if we take a closer look up by those deep cervical lymph nodes, the cranial deep cervical lymph nodes, which are right there. If you go just cranial to that, you can see this large ovoid dark colored mass, and that is the thyroid gland. So right here is the thyroid gland, and sometimes it's very difficult to see in this view, and you have to really work up towards the head there. So thyroid gland right next to my cranial deep cervical lymph nodes there. Now we're looking at the right side of the pony for the neck. And so we're on that right side where we had the right limb, forelimb still attached. And so more of your muscles are intact on this side. So you can see your trapezius here that was cut. You have your cervical portion of trapezius right there. So cervical trapezius reflected, Then underneath that, you have cervical rhomboideus right here. So cervical rhomboideus. Then you have serratus ventralis cervicis, which is this part that you're seeing right here. And then in between serratus ventralis cervicis and the rhomboideus cervicis here, you have the splenius muscle. So that's this muscle up toward the head here. Splenius muscle in between rhomboideus and serratus ventralis. Then here we actually have our brachiocephalicus muscle that's intact. So on this side, you're actually going to be transecting through your brachiocephalicus muscle to reflect this distal portion so that you can see the omohyoideus muscle underneath. But here we have brachiocephalicus, and here in the pony we have just that cleidocephalicus part here that has cleidomastoideus. That's the only part that the pony has, is the cleidomastoideus. And then your omotransversarius muscle, again, is fused to that brachiocephalicus. So it's this dorsal caudal border here would be omotransversarius, fused to your brachiocephalicus muscle. So like I said, you're going to transect that straight across and then reflect the distal portion of brachiocephalicus. So then that will give us a better view not only of our omohyoideus muscle here, but also that superficial cervical lymphocenter. So superficial cervical lymph nodes are in the lymphocenter in the pony. So a bunch of little lymph nodes clustered together right here, our superficial cervical lymph nodes. Then here we have the omohyoideus muscle running up underneath this external jugular vein. So external jugular vein here on the right side, omohyoideus muscle running underneath that. Then if you trace your external jugular vein up towards the head, you want to find where it branches. So it has the branch that's the linguofacial branch, which will be this branch right here. And then the maxillary branch, which goes up toward the head. So maxillary going up toward the head and linguofacial going transversely across here. In between those two branches, you have this parotid salivary gland that you can see part of. And you have to reflect that slightly to be able to see the tendon of that sternomandibularis muscle that we're going to talk about next. So sternomandibularis is this muscle right here in the pony, and that is equivalent to sternocephalicus. So either term is fine and they're interchangeable, but they mean the same thing in the pony since the pony only has the sternomandibularis portion. So sternomandibularis or sternocephalicus. And we look at the tendon that forms the border of the Viborg's triangle. So here we have the muscle coming up, and I'm going to try and pull that tendon out so you can see it there. So there's the tendon of the sternomandibularis muscle, and that forms that dorsal border of that Viborg's triangle. So Viborg's triangle is right here, in between that tendon and this linguofacial vein, right there. Then we also have, underneath your omohyoideus muscle, you want to identify your carotid sheath, and the carotid sheath is the fascia surrounding your carotid artery. So you have right common carotid artery here, and then you have vagosympathetic nerve trunk on the right side, right alongside it. And this fascia that surrounds it, I have a little more fascia left on this side, is the carotid sheath. So it'd be all that fascia surrounding the carotid artery and vagosympathetic nerve trunk. Then you can see the trachea here. And here's one of those deep cervical lymph nodes right here. It's kind of elongated right there. That would be a middle deep cervical lymph node. On this side, I'm not sure I had any. There's a couple cranial deep cervical lymph nodes right here as you move up towards the head. And here we have, if you have this left on your specimen, this is that sphincter colli muscle, very thin, and you can just reflect it or even just take it off and move it out of the way so that you can see your sternohyoideus and thyroideus muscles. We talked about these on the left side, but sternohyoideus and thyroideus muscles have a combined origin here towards the sternum, and you can trace those up to where they split apart into left and right sides. And here on the right side, sternohyoideus will go up higher into the head. So sternohyoideus, and then sternothyroideus splits off to the lateral side. So sternothyroideus goes more laterally, sternohyoideus going up higher into the head. Then, I'm not sure if we can see the thyroid gland on this side, but we'll try and take a closer look at that. So here we're just taking a closer look at the deep cervical lymph nodes. So these are the cranial deep cervical lymph nodes, this bunch right here. And if you go just cranial to that, you have to spread these muscles and try and get in there to see the thyroid gland. So this oval kind of dark colored mass is the thyroid gland right here, right next to those deep cervical lymph nodes here.